Hi everybody, it's Brittany here, and today we'll be talking about sudden coronary artery dissection. So, Scad is a rare disease which disproportionately affects women to men. Interestingly enough, in female populations it is often hormonally and stress-related, whereas within male populations it is mostly due to strenuous activities. Preventative activities to reduce the risk of Scad can be as simple as including a warm-up and a cool-down to your everyday exercise routine. Even though the cause of Scad is still unknown, it is thought to begin with the weakening of the artery wall. Some examples of the causes are fibromuscular dysplasia, multiple pregnancies, connective tissues disorders, systemic inflammations such as Crohn's disease, hormone changes, hormone therapy, and the use of cocaine. Scad can also be triggered by emotional events, such as family deaths, job losses, divorces, and it can even be triggered by physical stressors, such as giving birth or lifting an extreme amount of weight. And this is just a little bit of information about Scad that I think is really useful. Scad may be the cause up to 1 to 4% of all acute coronary syndrome cases. It occurs overwhelmingly in women. It may be the cause of ACS of up to 35% of myocardial infarctions in women up to 50 years old. 30% of all Scad cases are with fibromuscular dysplasia. Scad is the most common cause of pregnancy-associated myocardial infarction. Although any artery can be affected, the left anterior descending artery is the most commonly affected. Reoccurrence rate amongst Scad patients is 30%. So just a little bit about the pathophysiology of a spontaneous coronary artery dissection. It is a tear in the coronary artery, which allows the blood to build up in the space between the layers of the artery wall. This leads to a reduction or blockage of blood flow in your heart, which causes damage to your heart muscle and affects your heart rhythm. Reduced blood flow could also even cause a heart attack or even cause you to go into cardiac arrest. So these are just some risk factors of the disease. Some of these include recent childbirth, multiple childbirth, hormone therapy or hormone treatment, as well as underlying blood vessel, tortuous veins, fibromuscular dysplasia, or even the use of illegal drugs such as cocaine. Just to reiterate a little bit, Scad can also be triggered by a highly emotional event or physical stress. In one study, more than half of the patients experienced an emotional or physically stressful event before the time of their Scad. So some of the signs and symptoms for sudden coronary artery dissection is chest pain, trouble breathing, chest discomfort, dizziness, swelling, pain in the neck, shoulders, and arm, nausea, and rapid or fluttering heartbeat. You'll notice that a lot of these are the same as the symptoms for a heart attack, and this is because a lot of the Scad patients that we actually hear and are reading about are people that have experienced a heart attack and didn't realize that they had SCAD until after they had experienced this. So one of the first things that they'll do for you when you go to get a diagnosis is they'll give you an echocardiogram or an electrocardiogram. This is mainly just used to measure the heart's electrical and mechanical activity. While this is being done, another test will actually also be ran, which will test the troponin levels within your blood. Troponin levels actually rise when there's damage to your heart's vascular structure, so this is indicative of any issues that you may have in your heart. Moving on, you'll go to get a coronary angiogram, and this is just a image test which is used to gauge the size and location of the tear. If this is not an option for you, optical coherence tomography or intravascular ultrasounds can be used if the patient is pregnant or cannot do a coronary angiogram. More uncommonly, but effective, a multi-detector computed tomography scan can be provided to show a detailed image of the heart. As for the treatment, the management of SCAD depends on the location, length of the tear, and amount of reversible damage that has been done. The surgery is both an aggressive and risky treatment, so a lot of times they'll try to leave that as a last-ditch resort. A lot of the same medicines that are given to heart attack survivor patients are given to people with SCAD. So this is mainly just including blood thinners and things to regulate blood pressure as well. So this is just a diagram of a coronary angiography, and it is actually inserted into the leg and guided up through the aorta, as you can see here. The catheter tip actually stops at the left coronary artery, and then a dye is actually injected into the arteries, and an X-ray image is then taken to show the stenosis of the coronary artery. Unfortunately, most post-SCAD patients have reoccurrence of angina. Some medicines used to treat angina are beta blockers and calcium channel blockers, the goal being to limit the blood pressure and heart rate even during the exercise. Some other treatments for SCAD are ACE inhibitors, aspirin, of course, cardiac rehabilitation, and even stent placement. If you look to your bottom right, you can actually see how a stent placement is done. And what it is you actually have this little balloon on the inside of a metal stent, and it's going to be filled with air, and then it's going to expand in order to keep the artery open, and it's going to deflate and then be taken out while the metal stent is kept in place. Exercise outweighs in benefits than it does in damage, but depending on where your SCAD occurred and its severity, along with its length, comes into play. For example, does the patient have fibromuscular dysplasia? Has the patient had an exercise-related SCAD event before? Post-SCAD, moderate aerobic activities such as swimming, cycling, and running are usually safe. However, there are some activities that you will need to avoid. These include high-intensity interval training, or exercises that have abrupt starts and stops. Exercise that causes a very quick increase in blood pressure, such as heavy weightlifting. Activities which increase the risk of sudden or rapid severe neck motions, such as roller coasters. Or activities that maintain the neck in an extended position for a prolonged period of time, such as certain yoga positions. For your exercise recommendations, you should still be meeting that minimum recommendation of moderate exercise of approximately 150 minutes collectively per week, avoiding most or all vigorous activity. The aerobic exercise recommendation is a warm-up of 10 minutes, keeping your RPE at 9 to 10, a training, which lasts about 30 to 60 minutes, with an RPE of 11 to 13, and a cool-down phase of 5 minutes with an RPE of 9 to 10. In the upper right corner, you can see the Borg scale, and this yellow right here is where the patient would need to stay at pretty much all times. This is just a brief reminder that cardiac rehabilitation is recommended for all Scad patients, but this is just a brief overview in designing a program for a Scad patient. Most of them are the same, but you want to keep in mind that you want to keep your intensity low, so you want to keep it at about 60 to 85% of your heart rate max, or keeping your RPE of around 11 to 14. Some special considerations are to avoid high-intensity, competitive contact sports, activities performed until exhaustion, extreme temperatures, and isometrics. To conclude, to help prevent Scad events, practice stress relief techniques and be sure to include both a warm-up and a cool-down to your exercise and lead a healthy lifestyle. Although extreme, vigorous exercises can provoke Scad events in those who are susceptible, it is not an excuse to become sedentary, and with the assistance of EPs and RNs, cardiac rehabilitation is possible with the proper gradual training and rehabilitation techniques.